cardiac health. Now, as you know, that cardiovascular diseases are one of the most leading cause of mortality and morbidity in our country. Earlier, it was used to be the one of the most common mortality and morbidity cause of morbidity in America, United States, as well as in the developed countries. But what happens is that nowadays it has become it's called as a non-communicable diseases. These are becoming a burden for the developing country as well as. So, in cardiovascular health, what important to know is that what are the diseases that usually cause people to die. The one of the most leading cause of death usually is a stroke, that is also known as cardiovascular accident, stroke as well as the myocardial infarction, that is MI, heart attack, and sudden cardiac arrest, and other diseases as well. These are the three common causes of mortality and morbidity in our country as well as in other developed nations. So now it's very important for the public to know about the risk factor about these diseases so that they can prevent themselves from becoming victim of this disease. As some of the renowned artists like KK and one more from the serial actor, they died last year because of the sudden cardiac arrest. So, what are the risk factor that causes the heart to heart as well as the that one other whole the cardiovascular system to collapse are important to know, that public should know so that they can usually take care of themselves. The most important risk factor for cardiovascular diseases is hypertension. The hypertension is usually increasing day by day, and usually we classify the risk factor for the cardiovascular diseases into modifiable and non-modifiable risk factor. Non-modifiable risk factor usually they are age, race, and sex, and the modifiable risk factor they are usually, first is hypertension, second most common is usually dyslipidemia, and cigarette smoking, alcohol, and physical stress, as well as the physical inactivity and high fatty diet. These are some of the important cause factors for the risk of cardiovascular diseases. So you should be aware of this. You should check the blood pressure regularly, and along with that you can go for the fasting lipid profile test so that your cholesterol level as well as the total cholesterol level, triglyceride, all this lipid profile comes under normal. And third, you should avoid smoking. Smoking is one of the most important risk factor for cardiovascular diseases, and other causes like you should avoid the high fatty diet. Along with that, you can avoid the alcohol as well. So physical stress, you should, physical and mental stress, it should be reduced. You can reduce it by doing some yoga as well as the morning exercise, and other risk factors like that one physical inactivity that can be usually avoided by doing early morning exercise as well as the late evening exercise. You can do at a time, no problem. There is no fixed timing for that. You can do exercise at any time so that your body become body that is active, and it will prevent you from the cardiac diseases. And you should go to the doctor regularly, as it's earlier used to be the common cause for the elder people, but nowadays you can see the young persons usually die of the sudden cardiac arrest. It's an incident of about 1 month ago when a doctor that's coming to duty in the bus itself collapsed and died. It may be due to sudden cardiac arrest or due to myocardial infarctions. So it's very important for us as well as the people to understand the risk factor uh, and prevent as much as possible so that their family, their one, and burden of the country is reduced from the non-communicable diseases. For today, I am this much for today. So you can ask any questions if you have in the comments. I'll be answering shortly. Hello. Yes. He has written that he has suffered a stroke few years back. Is there any chance of re-stroke? Yes. If anyone suffer from the stroke, then there is a chance of second stroke always. So be careful. But I have they already said in the risk factors. Those risk factors usually causes the second stroke. And if doctor has advised you some medicines, then it should be taken regularly. Antihypertensive is a medicine that should be taken regularly. Many people what they do is they take sometimes, and usually if the BP comes to normal they suddenly stop taking the drugs. So it's a very bad habit, and it can cause the sudden rise of the BP, and it can lead to a stroke as well as the myocardial infarction, that's a heart attack. Second question is that if I see a person collapse, then what should I do? Yes, I have so many times said about the BLS, basic life support. Basic life support. What do we do is that we give CPR immediately, if preferably within 10 seconds of collapse of a person's. Give CPR, chest compression at the rate of 30, and give 2 rescue breath. Then again continue 30 chest compression. Like this you continue till health team arrives. You should see your safety first, then site should be cleared of any dangerous things, and you can do the CPR, you can give the CPR. I have given lecture on it, and you can see my earlier video as well. And any questions? No questions at present. So thank you very much for watching. Hope we will meet again tomorrow. I'll be going live again. Thank you.